Unong yalam kaliang persya jong ka yeng dorbar thawain ka jella u Dr.Mukul Sangma ulahir Sharibhoi district na kabenta ban Jurip eka maternity children hospital kabadon ha Umran yang bernai kaban sapen kelano syaka corona care center. Bad eka jakabu eka oxygen generation plan ha civil hospital nongpo. Ha kani ka jingli Jurip jong Dr.Mukul Sangma laisan ran lang daki MLA jong ka seng kongres kiba kentup yu ba HM Shangpliang u Zenit Sangma ba George Billingdo ba Meral Bonds im lembat ki arngut ki MDC u ba Balaji Rani bad u ba Charles Marngar. Harengkat ka jingdon lang ka Deputy Commissioner ka Ribhoi District ka Kong RM Kurba bad u DMNHO ka Ribhoi District u Dr. M. Mauri. Nakaliang u Dr. Mukul haba ay jingkeren syakilat patay kubor uloong habay day baka MCH ha Umran ka badangdon ha padang gajing penkre ban pengkela syaka Corona Care Center lai i baka jing penkre kadang ya syakmat bat kermenru baka sorkar kan pendap kamkloi ketika Corona Care Center kenang ban pensuk yu pajba. Bat hadin baulade ban Jurip yaka oxygen generation plan ha civil hospital nongpo bat iki rukam penkre ay jing sumar uloong bakam patbiang tang bala download iki tiar ay jing sumar haki hospital Henry de bandonru kinong sumar lani kinong tre ki pabiang bat kambun haki hospital kenang banla banirap iki babun kicing im jong gibril.
You see, we have been already briefed by the government on the measures already initiated and measures already put in place. And in our collective endeavor to fight against this COVID-19 pandemic, we have been visiting all the districts, particularly the facilities which has been created to fight against this pandemic, including the institutional COVID care centers, the community corona isolation center, the dedicated COVID-19 hospitals, and the kind of necessary infrastructure which were required to be ramped up, including the manpower-related issues. Today, we have visited that MCH hospital in Umran. The work is still on. Hopefully, they should expedite the whole process of this further finishing work of the infrastructure. But as of now, it's not operational. Now, the only facility which is available in Ribhoi district is only this civil hospital in as far as treatment for the COVID patients are concerned. Now, after having seen and after having collected all the inputs here pertaining to the facilities available here, including the manpower, see, the facility available here is not enough to save lives. If these facilities would have been ramped up, including the manpower, we could have saved more lives. We have been, from the day one after seeing the death count, we have been very, very concerned about the very alarming number of death count. If you look at the percentage, the proportion between the positive cases, new cases on a daily basis, and the death count, it has been always on a higher side, 2.5% to 3% it went around, which is very, very high. Therefore, it was necessary for us to find out what exactly is the reason. There are a number of factors. One part is that the home isolation part and the delay in decision of the patient to actually shift the patient who require immediate hospitalization, the duration, the decisiveness in transferring the patient to a hospital. Another part is obviously whether in the hospital we are being able to provide the right kind of intervention when the patients admitted in course of the progress of the disease start developing, if the cases ultimately turn into critical condition. I am very sad to see that other than civil hospital Shillong, none of the hospitals in the state can actually save the lives of the patients if they develop to more critical condition requiring ICU intervention. Number one, there is no manpower. So though we have the ventilators, though we have the ICU, they cannot be operationalized to save lives. We are very unfortunate to see that we have not been able to be ready. Doctors are here, they are trying their best. I can see the frustration amongst the frontline workers, because what is more frustrating to the frontline workers than seeing their patient succumbing? If they see fatality rate going up, it will obviously have toll on the frontline workers. They'll have real problem of stress and strain. And this is because the facility available notwithstanding, the manpower backup. There should have been people who can operate the ventilators. There should have been manpower put in place who could operate the ICUs to save lives whenever there is a critical case. But this is not happening. This has not yet happened. You cannot expect patients from Nongpo to be shifted to Shillong for further intervention when you're talking about saving a patient which has gone to a critical condition. So these are things which we have discussed. We will articulate them accordingly. The HODs are here. The DCs are now able to understand what are the deficiencies which are identified now, how we can actually ensure that these deficiencies are addressed at the RDS and save lives. See, that is one part. Assuring of something to be done and assuring that, okay, something which is in the pipeline will be completed on time. That is one part. But what is required is that whatever has been done and whatever is being done, whether they are enough. Even now here, if you look at the oxygen plant which is being installed, hopefully it will be done by another 3 days, 4 days. That's what is the indication given by the superintendent of the civil hospital. But the fact is that if you have patients who, based on the progression of the case, require more critical care, then what is going to happen? Just 3 patients will consume all the oxygen here. You get my point now? This is the technical aspect. Just 3 patients can consume the whole oxygen. So what happens? Are we really prepared? No, we are not. That's why this is just an initial probably intervention, but then we have to ramp up. You got my point. Only 3 patients will be able to be catered by this quantum of oxygen. Similar situation in other hospitals also. So anyway, we will keep on visiting and then we will keep on speaking to the government and then see that we all realign our focus, realign our strategy and see how we can put things in order. Everything should fall in line once we have a political will. So we will try to see that we have a collective political will and ensure that everything has fallen in line. We have to be very cautious because second wave is showing sign of flattening. But there are inputs to indicate that cases in the rural areas are increasing. Now, the number of positive cases on a daily basis may not be the correct picture, because only if those likely positive cases in the rural areas are coming forward to get themselves tested, then only we will actually know the real picture, the real number of incidents. But in absence of that, we will always have a figure which is quite a deviation from the correct picture. And therefore, any likelihood of the third wave, we must be very, very cautious about them. We must ensure that we are able to prevent the severity of next wave, or if possible, prevent the next wave altogether. But even if we cannot prevent, we must be able to prevent severity of next wave so that we don't end up losing precious life. Thank you.